there. Can you guys all see that okay? My Miro? Okay,
Now we
perfect.
can see it.
Good. And you guys are in it as well, right? Okay. So as I said, this is me, facilitator Kyla Avis. I'm a former registered nurse, and I've been working in the area of quality improvement since 2008, and then kind of stumbled into this world of systems approach approximately a year ago, and been really lucky and really happy to be involved in this community to support my learning. And as I said, the goal of our series is to help participants understand how to apply a systems approach to complex challenges associated with aging in place. So we're hoping that this gives you, if you're working in the space of aging in place or supporting older adults and community, this might give you some practical ideas. But even if you're working on a topic that's completely different, or a space in health or healthcare that's really different, you can hopefully still learn a lot from the tools that we're going to be using in the conversations we're going to be having, and the process of applying a systems lens to improvement work or system change. So we have a little introduction, we have a little icebreaker, and then we're going to get into the workshop portion, which is exploring and framing the challenge. So if you're able to move over, we're going to hear some of the things I talked about before. We have a hub in our systems innovation, which I'm guessing if you're here, you're a member, and if you're not, you can sign up for a free membership to be part of this community. This is our position paper that we launched, I think, in December of last year. So you might want to take a read of that to get more informed about sort of the thinking and the work that we're doing in this area. And then, the real purpose of these hubs is about connecting, learning from each other, creating together, and hopefully moving forward with some change or some new ideas or some innovations with regards to shifting systems and improving systems. And as I introduced before, these are my colleagues, Janine and Anne-Marie. Anne-Marie's my fellow Canadian here on the call. And then we have our neighbor to the south, Janine, Janine, you're in Pittsburgh, right? Pittsburgh, yes. I always have to think Pittsburgh Penguins in my head when I think about which city it is. So that is us. So now I want to get to know a little bit about you. So if you could move on over to the map and put a sticky of where you're from. And if you could just unmute or chat and say how this topic, how you relate to this topic, or how you connect with this topic of aging in place. And if you don't connect to it all, that's fine too. You can tell us the other reason why you might be here. But just take a minute to share with the group who you are and why you're here today.
Kyla, I can go first.
Sure.
Hi, everyone. I'm Tanya Verrill, and I am a colleague of Kyla's. I'm a Senior Director of Strategic Initiatives at the Saskatchewan Health Quality Council in Canada. And we have one of our strategic focus areas working exactly on this topic. So we are looking at how to strengthen community-based supports and care for older adults in our province, so that they can age well in their communities. We, like many health systems, have the issue of long-term care and overcapacity in our hospitals for patients who are considered alternate level of care, which tend to be predominantly older adults. We have a booming population of older adults in our province. And so, yeah, this is just a really, really timely event for us in terms of trying to think through our strategy. So looking forward to the conversation. Thank you.
And I would like to say we didn't pick this topic just based on the fact that I'm working in this area right now. But when we did have a conversation with our community a few months ago, the two things that popped up for people were sort of older adults, care of older adults, and also like mental health addictions. So we decided to go with this one first. But we know there's sort of a number of shared sort of health and healthcare topics that people are interested in that we hope to dive into in subsequent series. So yeah. Anybody else want to share?
I'll go. Hi, good morning. Well, it's morning for me. Denise Wiseman. I'm in Seaview, Washington, USA, and my focus is really healthcare broadly and truly more health and care. So not just our traditional healthcare systems within the US or other countries, but it's also how are we caring for the health and well-being of individuals in order to prevent chronic issues.
Great, thanks, Denise. Okay, we've had a Canadian and American contingent. Anybody from Europe who wants to share? Oh, hi, Anya.
Hi,
Go
I'm glad
ahead.
to join. Hi, Janine. Hi, I'm glad I could join your session today. I'm not sure if I can stay for the whole session, but I hope to stay for the series. So I'm here because of curiosity. Maybe I could build upon my thesis, which I wrote 2 years ago around health promotion for seniors and how to build better systems approaches to promote health and actually tackle an ageism challenge within the health promotion sector in Switzerland.
Amazing. Thanks for joining us, Anya. Anya was our support person for the starting up. We now have Paloma, who is also fantastic. And Anya and Paloma have been like super great supports to us in getting this hub set up. So thank you for all the work that you have done, Anya, and that you are doing for us, Paloma.
Thank you.
Anyone else? Paul, is that you?
Yeah. Hi, everybody. Actually, I am here because I'm from different field, though. I'm in IT and AI. But I have some feeling towards elders and especially octogenarian community. And actually, I left my stable US job for my elder parents. Actually, they are sick in back in India, and to take care of them, actually, I left everything, and I had a different plan to take them after curing them, maybe within a year or less. I'll take them back to somewhere else where they will be more comfortable. But the doctor said that time, those who have checked them, and they said, no, especially your dad is brittle now. It will be very risky for you to take them elsewhere. Even shifting your city within India will be difficult for you. And from then onwards, actually, I was very much involved with my parents' friends. They are also very elder that time, and some of them are sick, and they used to have a good time by talking with me. And they always still now they talk with me over phone and all, those who are still alive. And eventually I lost my dad last year. But the thing is, I still have a plan to utilize technology to help the elder community. If I get a concrete idea, I have some ideas using technology as a tool to help the elder community anywhere else, wherever they are. So from that perspective, actually, I am very much interested to know how you people are feeling about elders and what you are doing and all. And that's in a nutshell, I would say. If you
Great.
have any other question, you can ask me.
Thank you. And it's so important for us to have someone here who's been in that caregiver and support role for sure, because you'll be able to bring in a lot of insights and experience based on your support of your mom and your dad. So thank you for bringing that a caregiver perspective and also entrepreneur perspective, which is also good to have in our group as well, to think about the future and what opportunities there might be. Thank you for joining.
Thank you, thank you, thank you.
Anyone else burning to say anything? All right, and if you're not comfortable talking as well, you can put your connection to the topic in the chat as well. So I'm just going to move over. I just want to show you something that's new to SI Hub. It's called the SI game, and I think it's relatively new. I haven't actually like played the game properly or been a part of a session where the game has been played, although I know that the systems innovation group is, I think, maybe having some sessions coming up using the actual game. But we took the game basically as our inspiration for this event. So we're going to use some tools from it. We're going to kind of modify it a little bit. We're going to play around with it, which is like usually what I do. I never sort of take things and just do them as I'm supposed to. I'm always like wanting to play and wanting to change around. So based on the game, there are a number, or I guess 4 different phases that you would sort of explore. And so the first one is sort of understanding the problem and framing. So I refer to that as frame and explore in my own mind, or explore and frame what the problem really is. And I put this little quote in here. It says, fall in love with the problem, not your solution. And so today we're really going to focus on falling in love with the problem. We're really going to try to avoid getting into sort of like the future and the change ideas and the leverage points and the whatever. I mean, it might pop up, but let's really kind of deeply understand what we're trying to do here and what problem we're trying to solve in the system. So we've got a couple canvases that we can use to kind of explore that idea. So the iceberg canvas and the 3 horizons canvas. And we're going to dig into those, either one or both of them, depending on what you want to do, to understand the problem that we're coming to together to work on today. And then the card in the game said, what is the challenge and why do we need systems innovation in the context of this challenge? So we're going to talk about that a little bit more. In the next session, that's going to be held on the 28th, we are going to move into this mapping area here, and we're going to use Janine's expertise and experience in group model building and systems mapping to kind of put together a systems map of whatever problem statement or statements that we come up with. And I have to say that this is where my expertise sort of like goes really down, because I've never really done that kind of work before. But luckily we have Janine that is like fully tooled up and fully experienced with many, many decades of experience in that space. So we're in good hands for that session. The third session will be focusing on change. So that'll be exploring leverage points, change ideas. What are sort of the underlying systems that we might want to affect or might want to consider when using a systems approach to address the systems or the issues around aging in place or supporting older adults in their own home. And then the last session we're going to focus on is this build area. So that's where we're going to think more long-term and more strategically and more structurally about the changes and how to move them forward, because we know it's sort of not a simple, like, come up with the program and implement it and evaluate it and then you're done. It is sort of a long-term process. So yeah, are there any questions about this framework that we're using? Or has anybody played this game before with SI Hub? Okay, all right. So this is new for all of us. So that's good. Let's dive into it. So falling in love with the problem. So I found these 2 images yesterday because I was like, I found some Canadian stuff and I'm like, well, that might not be true for everywhere. So I don't want to sort of assume that the long-term care or the older adults and community situation is the same everywhere. But I think there's sort of this general sense of what I've heard called the silver tsunami, which is this like real sort of, we're on this brink of like the boom, baby boom generation and older adults really kind of all of it coming together with a huge population boom of that age group. And then also sort of this like antiquated system that we have that is designed to kind of support maybe more simple or complicated health issues, but maybe starts to fall down when you're looking at complex issues. And we've really leaned heavily on sort of our acute care system and, our family doctors to sort of manage the health and healthcare needs of our older adults. And what happens when those resources are really low and the need is really high. We also know that, I don't know where the source came from, but I'm going to take it as truth, that 90% of seniors want to stay in their own home. I'm not a senior, but if I was a senior, I feel like I would want to stay in my own home too for as long as possible. And then we just know, like, again, that in, you know, the decade ahead, it's going to be a real surge of older adults. And, you know, we're all that, especially countries that are up and coming are now starting to sort of deal with things like diabetes and obesity and all those sort of like chronic diseases that come with industrialization as well. So that's sort of the problem that we're talking about. And even though we're kind of framing it as a problem, it's also an opportunity to redesign healthcare, not only for older people, but also for everybody, right? And I think we had a consultant that used to work here in Saskatoon that said, if you can solve the issue for the older clients with complex care needs, you'll solve it for everybody. Like the ripple effects of redesigning for older care will actually sort of, you know, will kind of trickle down into other aspects of care services for everybody. So my sister was recently diagnosed with breast cancer and she lives in a rural community, and transportation is an issue for her, right? To get to 3 hours back and forth to appointments without any sort of public transit system here. So, you know, that's not just an issue for older people, it is also an issue for rural and remote people generally. So yeah, so that's what we're going to work on today, is falling in love with this issue. And there's two canvases we can use. And I just want to get your thoughts on, do we want to play with both canvases this morning, or do we want to focus on one? And if you have a preference, let me know why. Maybe we should play around with both if nobody really has any strong feelings one way or the other. So in this part of the exercise, we're going to be asking people to grab the little stickies from the left-hand side of your screen and pull them over. So we're not going to get into Horizon 1 or Horizon 2 or Horizon 3, which is more of the future thinking. We're going to focus on Horizon 1, which is business as usual. So those are the things that are like, what's the current system? What is the current state of our system? And if you have any thoughts about that, or you have any notes that you want to put in, just please grab a sticky and help us fill in that area. And then we're going to talk about the decline of that system. How fast is the current pattern declining, and what aspects might we want to see retained? And then down here at the bottom right-hand corner is, am I on the right one? Maybe that's the two that we want to focus on right there. Any thoughts?
So Kyla, are we taking from our problem statements, or sorry, where just make our own stickies, or take from
make your own stickies.
Okay.
We don't have any problem statements yet, but just to get a sense of what is the dominant pattern in the system right now. What is business as usual looking like in your healthcare system for older adults who are trying to age in place or not successfully aging in place?
Okay.
Okay, so we've got a couple around institutionalization, premature institutionalization. I think in Canada we found 1 in 9 people who are admitted to long-term care probably could have been supported at home. Lack of housing, so affordability and appropriate housing, yeah. We've got our, I'm just gonna add in here our lack of geriatric focus or expertise. Lack of practical home supports, yep. Social isolation, yep, for sure. I think they talk about like loneliness, like they equate it to smoking, like how many packs of smoking it would be, like in terms of how impactful it is on negatively on your health. Linear and quick fix mindset. Lack of time for healthcare providers. Lack of intergenerational housing housing options for sure. Yeah, sort of a reactive. I'm just looking in the chat here. Noor said Canadian system is very reactive rather than proactive. For example, speech and swallowing needs are only addressed when they reach a very serious condition. Yes. I'll add that in for you. The stigma perception of the care provided. So is that, I don't know who's sticky that was, but is that around like the older adults having a stigma or the healthcare system? Oh, Denise, was that yours? Elderly people feel invisible. Yeah. Insurance complexity. Narrow criteria to advance the next level of care. So I remember I had a friend who her dad had full-blown dementia, was like so dangerous living on his own, but because he was still continent, she couldn't get him into a care facility because he had to be incontinent before he could get admitted into the care facility that he actually needed. So like rules like that, which are so like just really aren't very patient family centered. Yeah. Yeah, dementia care, really, someone just added that is like a huge place for improvement as well. Long-term care is a place you go to die. I've been trying to get my dad to go to physio, and he's been really reluctant to do so. And then I told him it's called long-term care prevention program, and then he was like, oh, okay. That's That's more interesting to me. So there's a real fear, I think, for older adults of long-term care, which is not good, right? That should be seen as a place like that is supportive and you know that you would want to go to at the end of life. And I don't know if that's just in Canada. Maybe in other countries it is seen as a place that is like, you know, that they're happy to go to. I don't know. If that's the case in your system, that'd be great to share how that might be
This is a
different.
really interesting couple of comments. Because the more we age in place at home, the more long-term care facilities actually do become the place we go, because it's for the sickest of the sick.
Right.
So the place we go to die. And when we were prepping, Kyla told Paloma, Amory, and me about a video called "The Last 1,000 Hours."
Last 1,000 days.
Or last 1,000 days. Yeah, that
Yeah.
makes more sense. Yeah, sorry about that. Yeah, last 1,000 days. So the last, was that about 3 years of a lifetime?
What does that look like? Yeah, it's an NHS video. If someone, Tanya, if you could pop that into the chat, that'd be good. Maybe people want to see that.
I can look it up. I was also thinking just the notion that people think of in Canada anyway, long-term care is like when you say that, you think of a building, and just the appreciation that care needs are on a continuum. And when we say you need long-term care, it actually means you have, like within a 24-hour day, you actually need more care provision, but it doesn't mean that it has to be in an institutional setting, right? So trying to break out of that thinking that, you know, at a certain threshold, there is no other choice for you. We will put you in this institutional setting because for the system, that's the best way we can deliver that care. So I think that was an aha for me, is just realizing that long-term care is not about a building. It's about, you know, the acuity of the need, or the amount of care that's needed. So I'll try and find that for you, Kyla.
That's a really good point. It's almost like you fail, you fail, you fail, you fail, you fail, and then our system is like, here's a long-term care bed for you. Right? So how do we kind of break out of that way of thinking about older adults and their care experience? So great, we've got a good
Tanya, did you put a post-it about that on there? If not, I will. That long-term care is
Yeah, I
currently.
haven't. Sorry. Yeah, no, I didn't get a chance yet. I think I found the
I'll grab
video.
one.
Yeah, thank you.
Oh, Denise put up the video. Thanks, Denise.
Oh, there we go. Look at that. Oh, there's two
Yeah.
different links, but yeah. Okay. Thanks, Denise.
All right, I'm going to move us down now to the next question is, how fast is the current pattern declining? Like fast?
You mean the current state is not that, or that
Yes.
like it's getting worse?
Yeah.
What do you mean?
Yeah, so I would say, how fast is the current pattern declining? I would say, how is our system starting to fail? Is it failing rapidly? Is it declining slowly? Like, is it sort of the frog in boiling water kind of analogy where the heat's being turned up and people don't really realize? Or do you think we're moving into sort of full-blown crisis or like an ability to not sustain our systems?
Well, in our system, it is very rapid. And I mean, the acute or the reactive responses like capacity planning. And I can share just a personal story. So my father had his third fall. So he was hospitalized. I just got him home last Thursday. He had 3 broken ribs, previously broke both his hips. But he got moved out prematurely from the hospital because we had this domino effect of a capacity plan where alternate level of care patients were to be put in care homes. They had this arrangement. There was a safety incident at this place and they shut it down and they had to find places for these folks. And then it just dominoed and Dad came home on Thursday. So yeah, I mean, I'd say being a caregiver and seeing both sides of this situation here in Saskatchewan, I think it's really bad. And my mom, so I've been a caregiver for 15 years. It started with my mom, then went to my aunt, and now my dad. So I would say, yes, definitely the trend is getting worse. And then you
And
compound that with older adults, the population growing, right? So we're not keeping up with that population growth and the complexity of needs.
the silver tsunami in your own house, hey? Yeah. And Denise, you put in there with the post-COVID healthcare crisis, long-term care is also suffering.
Yes. Yeah.
So really, probably COVID really kind of, I think for all our systems, right? COVID really, really impacted them.
And I think that's where people were starting to question, why do we have these facilities? I mean, I think it was always so accepted, but then like, are these safe places? Are they the right place? So it could be an opportunity, but you know, our government was just so focused on building more long-term care beds. That's the answer for everything. And then when you have this pandemic crisis where people are kind of questioning if that's a safe place to put your loved ones, you know, that's, so then there was kind of like, don't build more of those because politically that would look bad because we haven't figured out how to make these safer places.
So I wonder if COVID kind of like sort of initiated a bit of questioning around the system that we have in place. You know, I mean, I think it was sort of bad before, but maybe COVID really, you know, because I'm starting to say like questioning is starting to happen. So people are starting to ask, what is this the system we want? Is this the system that's the best? And I feel like once people are starting to question things, that's where there's an opportunity. So maybe this is the questioning. Maybe there is, maybe it's not maybe a declining of the system yet, but there's certainly a more awareness or possibly even mindset shift around this.
But I also think, Kyla, it's more pressures, right? Like, so there's the long-term care piece, but then if you, from a systems perspective, like housing in general is not great. And we have a huge influx of new Canadians coming into our province, which is welcomed. And we don't have the housing infrastructure to support, you know, the growing population. And then you have rising inflation, fixed budgets for older adults. They can't find affordable housing. They can't find housing in general. They can't find housing that's going to meet their needs. So you don't have many options. And if you don't make the criteria for long-term care, that's why we have an alternate level of care issue. We have many, many alternate level of care patients in our hospital system who are unhoused. The reason they're in that bed is because they have no home, not because they necessarily have any kind of, you know, medical needs or even, you know, anything. It's social admission. So I think the pressures on the system are just like huge. I can see the map already. Sorry, Janine, I'm jumping already to mapping it out, but yeah, it's pretty complex.
Denise, do you want to speak more to this sticky around private equity organizations?
I don't know if other countries are having this, but private equity firms are coming in all sorts of areas across our country. They are currently stepping in and purchasing a lot of long-term care. They come in and they say that they are lean and they're cleaning things up, but what they're really doing is sucking all of the money profit that they can out of those systems and then leaving them behind. So the short term, they're profiting, they might look good, but we're seeing the outcome as being very detrimental.
Denise, I just wrote in the chat, we have this issue in Canada, or at least in Saskatchewan, but it's with private personal care homes. So where my father actually lives was bought out by a Canadian monopoly business. So they have now across Canada, you know, under one umbrella type of thing. And yeah, the care changes and people got fired and, you know, these people had relationships with the older adults in the building and it was quite a shakeup.
I think that's a great opportunity and to move our discussion down to the iceberg. So if we're looking at the left side of the iceberg, we want to talk about current events. So events are the individual activities or facts about the state of things in the system. So write in the box around events, associated variables in the system. So an event might be sort of the privatization or the yeah, I guess privatization of care services for older adults. That might be an event that is happening. That is an outcome of the system as it's designed. Are there other events that we sort of got to or addressed? So I guess institutionalization.
A couple with privatization, the mergers and acquisitions, even with, once things are privatized, because I heard a couple of people say that, and I've seen it as well. Long-term care organization gets bought out or merges with another, and there's a step change in good to the good or to the bad in quality of care.
I think an event is that we have poor caregiver experience and like poor, I don't know, poor outcomes, poor experience. I don't know, what would people say? Like nobody's happy?
I think, and I don't know if it's an event, but it kind of summarizes maybe a little bit of what I've seen from chatter around this topic. And it's almost like where we talked about with the pandemic, people started to question long-term care. And I think once you get into the system, so this is me hanging out in the hospital ward with other caregivers and chatting with them, and like how they are shocked with how bad it is. So until you are faced with having to find a place for your loved one or deal with this, you kind of assume that it's all tickety-boo and it's all there. So I think more people, because of the needs increasing, are becoming, there's more awareness, I guess. And I don't know if that's a event as much as it is just maybe a pattern that's emerging that I think in terms of people being satisfied, Kyla, or they're waking up to the fact that, and especially in Canada, like that this public system is not doing what we would hope it would do. And at our
So I added a
organization,
post-it for you.
thank you.
Tell me if I captured it. So I think there's an interesting thing here about events. Events for people as individuals, for citizens, humanity, events for organizations, and they're all legitimate events. So I put here for individuals, a health event that leads them to need long-term care, whether it's at home or in a building.
Yep.
Which is way different than I have an event and I have to go to the hospital for a couple of days and then I get to go home and I'm like, just great. Right?
Yeah, it's almost like it's a chain reaction that just people are like, how do you get off this conveyor belt? And like, you don't, you just stay on it.
Anne-Marie put in the chat, we've not necessarily talked about this, but I wonder about a mindset. Oh, I lost it. Mindset in certain cultures that older adults are a burden to the system rather than contributors.
Yes.
I think that's an excellent mindset. You can put that at the bottom of the you can put that at the bottom of the
ageism
around mindsets and sort of that ageism.
Yep, it's huge.
Or current models, I guess we've got down at the bottom.
Okay, and so, you know, a lot of older adults are without a physician. So is that also an event? I mean, I guess it's like this HR crisis that we have trickling out of the pandemic, where caregivers were burnt out and we have kind of the workforce isn't there to support. Even care aides, personal care workers, I'm sure they're called different things in different countries, but is that an event, Kyla, or is that a
Tanya, I think that's a really good call out. I would call it perhaps a societal event. We are seeing in the States that more and more physicians, if they continue to be along the path of actually being a physician, are going towards the specialties rather than being general practice or anything else. And I think that's a societal event, perhaps.
So we don't have a strong foundation of primary care in our province. And so we are basically designing for downstream, again, thinking about hospitalization, inappropriate hospitalization, long-term care, inappropriate long-term care. It's the chain reaction of the fact that even upstream older adults with complex needs aren't getting care in the community that they need. The other thing I was thinking about is we kind of refer to it as like the gap between primary care and hospitalization. So this kind of intermediate services space, home care, there's been some models that have been tried, like hospitals at home, but it's kind of tied into the human resource piece. There isn't a structure. We cut funding for home care. Oh, Kyla, what did Marlene share? It was like over
2008 or
yeah,
6.
and we are so paying the price for that now. But it's this gap. It's like no man's land. Like you don't, and now that you don't have a primary care doctor, you show up in urgent care or you show up in the ER, and that's where your care begins.
I was listening to a report yesterday on NPR that was talking about the difficulty in finding a bed in nursing home when you know your loved one needs one. And so the current situation in the States is the physician will tell the parent or the family, bring your loved one to the ER, get them admitted, and then leave them there. And the hospital can finally get them a bed.
Yep, that's what I did with my aunt, and that's what the family doctor told us to do.
Yeah.
Take her to city.
Is a
don't
key
let her come back.
driver in ED waits and unable to get people admitted into the hospital, right? Is if the beds are often taken up by people who are waiting for care placement. Yeah. And then, the person who's had the appendectomy or the gallbladder attack or whatever can't get their surgery because they can't get a bed because they're filled with people that are waiting.
So our lack of addressing our needs in long-term care is actually hurting the system downstream as well.
Yes. And then the system upstream is not functioning right now. And then you've got compounding it mental health and addictions crisis, which leads to more hospitalizations. I mean, in our city, in the fall, when you have flu season, it was like the trifecta of flu, mental health and addictions, and older adults, and the mixture of all three. So
it would be a good event to call out too.
Okay.
Seasonal events, right? So COVID, flu, when multiple seasonal viruses or whatever hit at the same time.
Yeah.
And we know what happens. We just are usually not well equipped.
Yeah.
And I also wanted to chime in on the going to the ED is sort of the ticket into the system. I literally yesterday read an article about the adverse effects of ED boarding on the elderly. So ED boarding is an issue. I know it's an issue in the United States. Sounds like it's an issue in multiple countries. And if you're relatively healthy 40 something, you cope. If you're a frail 80 something or 90 something, not so much. So it's your ticket in, but it could also be the thing that ends you, actually. Mortality rates actually increase.
Well, and to tag on to that, Janine, here in the States, of course, we have deserts of care. So if you're in a rural area that does not have a local hospital, then you're challenged for that as well. So I don't know if healthcare deserts would be a current pattern or something as well.
Yeah, for rural and remote for sure as well. Yeah, I think
that's true in a lot of countries. Is that?
Yeah, we're getting a pretty strong North American perspective. Not sure if there's other perspectives that people want to weigh in on in their own health systems.
Yeah, because I know we have India and Europe here. At least.
I like we will all die We all will die, the current model, right? Yeah. And the fighting against it, right? And it's almost like seen as an acute care event, that older adult thing, right? So how do we sort of think about those last 1,000 days of people and how to make those the best possible? Yeah. Yeah, our current, and we also have a mindset around older adults not embracing technology. It's true. As soon as somebody comes up with a digital, everyone's like, oh, old people can't handle the computer. I'm like, well, my dad's almost 80 and he's on the computer every day. So some for sure, but not everybody.
Yeah, so for the techies in the room, I would say that's a gauntlet we should be throwing down to ourselves, that we should be making the tech easier.
Yeah.
Right. And that's true for all ages as well. It should be intuitive tech, not we all have to learn to think like a computer. We should think like humans, and the tech should meet us.
Intuitive.
While we're talking about morbidities and things, kind of like the sadder aspects of this, family care. So there are some statistics out, and I know we have a number of family caregivers or friend caregivers here in the group. So I think in the United States, and I'm going to guess this extends globally, family caregivers, 40% will predecease the person they care for.
Wow.
That's a really high percentage.
Wow.
And the number of family caregivers, again, in the US, I'm assuming this is global because we're all, because of the global aging trends, the number of family caregivers has increased dramatically in the last 10 years. Right. So you've got the health of the family caregiver, the morbidity of the family caregiver, people dropping out of the workforce, men and women, especially women, but men and women. It's another systemic thing, right? It trickles down into all other parts of life. And it's a long game, right? So when the health systems of today kind of don't look that broadly out to the family of the elderly, what we're doing is stacking the deck for worse problems in the future.
And I just put in current model sort of the devaluing of that caregiving work, right? That caregiver role, particularly as it's taken on a lot by women. So that devaluing of early childhood education and educate, youth educators, childhood educators, and then also nursing care, and then informal caregiving, and that sandwich generation as well. Yeah, heavily focused on medication. So I put sort of under structures, I put like there's no structural support for informal caregivers either, right? I mean, maybe there are in some systems, but it's really your own time, your own gas money, your own, your volunteer work. And how do you do that if you're also working and you also have children and you're also caring for older adults? Yeah.
I'm really curious to hear from other countries. And I don't know if we have any one reflective of the Asias, but my perception is in Japan and others that there's more generational living and thus care given, and maybe culturally their societies are more view things in that nature differently. It would be lovely to learn from to see how we differ in that regards.
Okay.
Adding a post-it for intergenerational living trends by country. That's super, super interesting.
Yeah, and I
oops, sorry.
Go ahead.
I was going to say that I can briefly talk about having been an immigrant from Malaysia to the Northeast US. Basically, aging parents are taken care of by the families. So you are supposed to be housing your aging parent in your house, right, with the kids. So there's a lot of support that way because there's a lot of relatives around to also help, and there's lots of social social interactions and social support because the families are mostly well connected which is the complete opposite, right, of the American culture, where you are supposed to be this, self-sufficient nuclear family. So I think there's a definitely at least in my experience, there is this mental model where you are not really taking care of your aging adults because you are supposed to be supporting your future generation at the expense of your aging adult. And I, I
I
don't,
wonder, I
yeah,
was just going to ask how that relates though to the older adult itself, because I think from my parents' perspective, because I totally agree with you, but there's a level of expectation, I think, around older adults that I can do this, right? Like I am supposed to be independent and I will, and I don't want to burden my children. That's not acceptable. I get that from my father, and my mother was the same way. So I guess it kind of is both ways. Like it's just that whole large expectation around what you described. And our colleagues here in our organization who come from different countries shared that. Like my colleague Alice said, I would never, ever put my parents in an institution, ever. They will live with me first. And that is, it's almost like it's just so normalized. But how do you shift? Because we have intergenerational housing models that people try but what they do is they'll bring like preschool children into an institution and have the preschool in there or the daycare. And it's like, oh, there's children, or they'll bring teenagers in to interact with the older adults. But it's not a family. It's kind of like we just bring different groups of generations together in a place. So I think it's really interesting to explore why that is.
yeah. And if you look at the blue zones as well too, it's quite similar, right? The blue zone, like Okinawa, there's always intergenerational socialization, I guess, that's normalized and not just in the family. Yeah.
And Rachel, I know we're not trying to get into sort of like solutions and stuff, but what are the structural supports that allow families to care for, or are there any? Is it just sort of accepted, we just do it, or are there sort of systems or structures set up to support a caregiver to bring an older adult into the home with them?
I feel like there's a lot more social, right, than it is structural. I think the social supports are cultural. So yes, you have to do it. You figure it out if there's no other alternative. So I think because there are lack of alternatives, that is part of what drives that way of caring for adults, I guess.
Yeah. Without it there, without the beds, you have to adapt. You have to survive.
Exactly.
You have to figure it out. Right.
You don't have a choice. Yeah.
Right. Okay. So just in the interest of time, and I'm sure people will need to start dropping off at the end of the hour as well, but we need to come up with some problem statements. So Janine is going to be mapping with us next session. And so I'm like, okay, what do you need? What do you need out of this session? And she's like, I need like 3 or 4 problem statements. What problems do we want to solve? Janine, do you want to expand on that a little bit more?
Yeah, sure. And so I'll augment Kyla's statement. So I did say that. However, I'll augment it with, we have an incredibly rich set of Post-it notes from this conversation. And because of how my brain is wired, I will be pulling them all into a spreadsheet and I will mine them a little bit. So I'll do some offline partial processing. I will not try to put words in people's mouths, but I will try to partially process and extract some themes. But all that said, given everything that everybody has talked about, what is still at the forefront of your mind that is a problem that you would love to unpack? and say, like, out of all the things we said, this one is still sticking right here. And I want to dig into that one more. So I think if everybody can put something like that on the board that Kyla's showing now, and then I'll marry that with some processing of all of the post-it notes.
And Marie, you had your hand up?
Well, I was going to say, like, what I observed is I wonder if we can, like, if a problem, Janine, to solve would be, we're viewing from the conversation a lot of this as a transactional system, right? How do we design a system? So, but that's not the problem we need to solve. It's like it's like a shift in the perspective of this is a life event and designing a system to support whatever life event might happen. So I haven't watched 1000 Days, but it's like moving away from designing a very transactional system to a system that is centered around the whole person. But that might be too, I know it's not tangible enough, but that's what I kept hearing throughout this whole conversation.
It's okay.
Well, I think
put it on there and we'll work
like
with it.
why do we have this transactional system, right? Like that's kind of what I would second that. I think that would give us a lot of different, because it would get to mindsets, it would get to the structural pieces.
I'll write it down and we'll see how Janine pulls it all in.
Curious, what level do we write these problem statements at? Like, is it,
whatever's on your mind?
Okay.
Yeah, anything goes. So the interesting thing about systems work is we'll have to sort that out. 50,000 foot problems from 2 feet on the almost on the landing strip problems, but they're connected, and that's what we do in the map.
I put in there mine. I'm not sure as a facilitator I should be allowed to do that, but I did. We talked a lot about this idea of like this caregiver burden, right? Like how do we kind of unpack that so it's not, they aren't seen as a burden and we don't see them as a burden. It's like, how do we restructure our system to like have this be a joyful part of life for both the person and their family? It shouldn't be this like stressful, horrible work, like part-time job kind of event to get. So if we could crack the system so that nobody feels like they are a burden or are burdened, like maybe that's an interesting place to explore.
You're writing that down, right?
Yeah, it's there.
Yeah, and I'm a family caregiver as well, and there's totally not enough joy in this job.
Yeah.
I had to have the conversation with my dad that I'd like to be his daughter again.
Yeah.
You forget what it's like just to sit and have mother or a father-daughter relationship when you're busy showering him and trying to help him get dressed and fed and all that kind of stuff. So yeah, it's a whole other level of get to know your family.
Yeah, and I think, people think, well, then they place their person in long-term care and then it'll be fine. But then you feel guilt, you feel worry, you feel you have to be on it. Did they get this care? How is their care? What's happening to them in there? Like that's not a put them in and forget it and then you feel fine. Like it's also years of stress for the family to have people in long-term care as well. Anything else? What other problems would we like to solve? And I like how in systems innovation, often you see we're not solving a problem, we're dissolving a problem. So how would we dissolve this? How would we want to go about dissolving this problem, the problems that we sort of came up with?
I know it might be too hyper-focused, but I am thinking about understanding more the issue around actually where people are housed, like the whole issue of where the physical structure of where do I live, and maybe it plays into the intergenerational piece too, but just the affordability, the types of structures that are put in place, like we talked about the long-term care institutionalization, but also private care homes. I think there's a lot to unpack there about where you live, just thinking about social determinants.
Sort of, I'm going to put bed blocking. It's a, you know, a bed
Yeah.
blocking. It's more of a transactional probably process kind of, but
it's just become normalized.
Yeah.
It's become acceptable that we actually, you know, we manage what we measure, and we measure alternate level of care beds. And it's like for some reason, you know, it's not even acceptable to have one. It's like falls, like, oh, I hope we get to only one fall this week. And like, how about 0?
Yeah. And that is the how can we fix our housing options that goes with it. That was the one that
Yeah, I
Tanya,
was
you
just,
said, okay. So
I
put
think
those
there's
together.
just so much to unpack, and I feel like it relates to a lot of what we talked about with the differences culturally as well. So
I like it.
Any other problems anybody's interested in solving? If we could solve these, that'd be great. Let's get
did
on this.
Paul, I remember at the beginning you were sharing some of your journey, and I'm just wondering if there was something from the technology side of things as well, or.
Oh, yeah, 1 sec, he said.
Sorry to put you on the spot.
No,
Oh, he's
Hi,
back on
Paul,
mute.
go ahead.
I think, Paul, you're back on mute accidentally. It momentarily came off and back on.
There you are.
thank you, thank you, thank you, thank you so much. Yeah, it is hiding my these icons here in the bottom. Yeah, what I wanted to say is, see, the loneliness, that social loneliness and other kind of the related issues they have, you know, what I realized, I actually used to talk with them a lot, different my parents, friends, and all the eldest people, even in US also. They're very nice people. They got aged and all, and I feel some kind of loneliness actually, and related to that loneliness, they have some mental agony or pain, which they can't express clearly to the family members or the people around them. And they feel sometimes hesitate to say all the details or anything, and even in briefly also they feel uh, don't feel comfortable to express those things. So I feel that we need people to talk with them periodically or daily, or with some empathy, with some storytelling, some kind of ideas, so that they can talk with them and open their heart out, and they can express themselves more. If we don't let them talk, I think their pain and their loneliness actually increases. So we have to think one solution from that perspective, that we need some kind of solution. At least one part of the solution is that we should give them a kind of some kind of, what I should say clearly, that accompany some company to them. Some people should accompany them with some, for whom they will be waiting to talk with them the next day again. So we should create some kind of environment for them.
Yeah.
We should brainstorm about this particular idea, if you can understand what I am saying actually.
I capture that as create more means of social interactions, socio-technical.
Right.
And I think, we talk a lot about mental health for youth. And I often think about, you know, the mental health of older adults in terms of the loss that they must be experiencing, right? Their friends, their homes, their, you know, families growing up, the life that they've known is like a tremendous amount of loss in their later years. And then we don't really have anything for them to support them through that, even if they're, you know, well and functioning and maybe still in there. Around them is just loss all the time of their friends and partners, and you know, that's a lot to go through.
Right.
Yeah, so I
Right.
think that that pain and loneliness is
Yeah, that is actually making havoc to many of them. Uh, s- Even if they are their own home, also, even if they are not in the homestays or other places, or but even in their home, also, I feel they have that kind of feelings that they need some people daily or some at some intervals, so that they can actually talk with them, laugh with them, or express their feelings with them, whatever that actually helps them. And it is what I believe is it is not necessary always to be present physically. I think over the call or over some way, using digital technologies and all, we can solve part of this problem actually. It's like that. When they talk with the people, and if they like that people, they feel very good whole day actually.
mm, yeah, for
So
sure.
yeah, so I think we should take care of those things. And sometimes see, they have, see, everybody has different kind of problem. Even their family members might have many problems, they are not around and all those things. That's part of life. But uh, there's some kind of social interaction should be there in some form. Like what I try, sometimes anyways, I try to take them to movies or some parks or some
Mm,
fairs, so they used to enjoy to go to those places actually. And me having as a guide, sometimes I was not available always, but whenever I took them, I used to feel very good about them, that they felt so happy, because they don't get those opportunities much, because nobody takes care of those points. People doesn't have much time and maybe the opportunities and all those things, so they might
right,
have money but they don't have that those things. They're feeling some void in that perspective.
right. Yeah, great. Anything else that anybody wants to add? This is really setting us up for our next session when we're going to be doing some mapping and group model building. So if there's anything that's really sort of on your agenda that you want to throw in there, please add it on. Is there anything that's sort of piquing your interest, Janine, as our facilitator in the mapping?
Oh, hang on, I'm typing. Even though I kind of paraphrased a couple of things as a goal, I wanted to get this idea of elder abuse and neglect like squarely
Mm,
on the board. So I just put a post-it. Yeah, oh gosh, it's a very rich set of problems and comments to work with. So I don't know what's popping out to me personally. Um, they're all good problems to tackle. They're all interrelated. So again, what I'll do is I'll do a little bit of processing. Kyla, Anne-Marie, Paloma, and I will be meeting next week. So we'll process and prep. And the way I like to work this is I'll come in with a few things on a board, just like Kyla came in today with a few things set up, but we'll go where the energy of the group is. So if we have 3 or 4 starters and we all want to rally around 1 or 2 of them, that's great. If something new pops up, that's great. We go where our thoughts are, and that's usually indicative of a mix of this is a big problem and one that we think we can solve or at least influence. And so somewhere along the way, we'll talk about that too. Like, when is this problem within our control or influence? When is it way out of our control, even if we see how to influence it? So that'll be part of the process as well. Because the reality is we all have day jobs and day lives. I don't know if anybody is here working public policy, but I don't. I'm not in public policy. So I can't personally affect anything that requires public policy, but I can affect other kinds of problems with the health systems I work with. So we'll have some of that conversation as well. Anyway, I think I answered more than your question, Kyla, but was that okay?
Yeah, no, that's good. And I mean, part of the learning, and we'll share with the next session, like what we did in between to process the data as well, what your thinking process was, because I'm actually curious with that too, like how you take all this information and kind of pull it together in terms of having a good question on which to start mapping. So as everybody is here, probably as I am, like just interested in the process of what you do with all these ideas and all these conversations.
Okay. I will share my spreadsheet then as well. So
Ooh, great.
Just as a heads up, like I'm a spreadsheet person. For anybody who remembers Lotus 123, I've been a spreadsheet person for ages. It's all going to go into a spreadsheet. So Miro allows you to export pretty easily. And I will do some affinity grouping. I'll probably put a little emergent taxonomy, right? So here's what everybody said, but here are some themes associated with that. Affinity group them, but also look for the themes that can be abstracted. And then take some verbatim problem statements as well as some extracted problem statements. And then I put them on a board and start drawing. So if we were in person, we would have a wall of Post-its and I would be moving Post-its around the wall. But even when I do this with a real live wall, I still create a spreadsheet because Post-its, it gets unwieldy with Post-its on walls. So there would always still be a spreadsheet. But yeah, I can actually share that in the interest of let's all learn together. Plus, it'll give you all a chance to weigh in. Just because I'm partial processing doesn't mean I get it correct. I'll do the best I can, but I'll give everybody a chance to weigh in on that as well. Yeah, thanks for saying that.
Thank you. That's great. Yeah. Okay, so that's the setup for the next session. That's what we're going to be doing. The next session, we were going to do these weekly, but we just found that that might be too pushed for people. So we're going to change it to every 2 weeks. So so if you want to mark your calendars, they'll be at the same time every 2 weeks for 3 more sessions. So I believe I think we're doing the 28th, 11th, and 25th, if that sounds right, or something. Yep. Yeah. And so you can RSVP for the next session. It's in the Miro board right there. If you're new to the hub, you can find us and join as a member in our healthcare hub. You can follow us on LinkedIn. You can watch this recording or share this recording with others after the event is finished. And there's not many of us left, but if there's any feedback you could give us, any insights, either on the Miro board or through a private message, we'd love to hear your feedback. And we're not going to ask you what events you'd like to see next because we're full with this one. But after, if there's a topic down the road that you'd like to go through this experience or this process again, we would love to do this again on a different topic. So if you have another topic or even a speaker or a presenter you think might be valuable to this discourse, that would be great for you to share with us. And again, if you're on the feed on Systems Innovation Network, you can also put it on the feed too, or send us a chat in that forum as well, or LinkedIn. We're all on LinkedIn. So we encourage you to keep us at top of mind. If you think there's a good presenter or topic that we could dig into, we're always looking for ideas. So I think that's it. Any other closing statements anybody wants to make? Okay. Well, thank you so much for joining us today. I'll let you up 10 minutes early. I hope you have a good rest of your week, and we'll hopefully see you in a couple of weeks. Thanks for all your contributions today.
Thanks, everyone. Nice to meet
Good
you.
day.
Bye.
Bye.
Bye.